Mr. President, the Congressional Review Act, or CRA, resolution we are debating today is the latest attack in the unrelenting Republican crusade against funding or defunding Planned Parenthood. They've tried everything: passing standalone bills, attaching poison pills to must-pass bills, threatening a government shutdown, struggling and failing to pass Trump Care. Today, we are debating whether to repeal an administrative action that protects abortion providers like Planned Parenthood who receive Title X funding. And just a little while ago, Vice President Pence was here to break a tie because Republicans in Congress couldn't get enough men to tell women what to do with their bodies. For nearly 50 years, Title X funding has helped low-income Americans access vital health services like birth control and cervical and breast cancer screenings. Title X funding has been a healthcare lifeline for millions of women in all parts of the country. But if this Congressional Review Act resolution is passed, Planned Parenthood clinics across our country can be prohibited from receiving Title X funding, even though it is currently illegal to use federal dollars to fund abortion services. Let me repeat, no federal dollars can be used to fund abortion services, period. I understand the strong anti-abortion belief held by some of my colleagues. What I don't understand is why this belief translates into relentless attacks on an organization that uses no federal funds for abortion. Planned Parenthood uses federal funds to provide vital healthcare services to millions of people, mainly women. And yes, I acknowledge there are men who go to Planned Parenthood also. In 2014, Planned Parenthood provided over 600,000 cancer screenings and over 4 million tests and treatments for sexually transmitted infections. But this is a factual argument. And we've learned over the years that many of my Republican colleagues simply won't listen to facts when it comes to Planned Parenthood. So let me share a few stories from my constituents about the transformational impact Planned Parenthood has had in their lives. Perhaps, after hearing these stories, we will think twice about attacking the vital services Planned Parenthood provides all across our country. Hawaii is home to a large military community. Taylor from Honolulu is a military spouse who wrote to me that she and other military dependents turned to Planned Parenthood because of long wait times and confidentiality concerns within the military healthcare system. Taylor wrote, quote, "My friend was experiencing severe cramping and pelvic pain to the point where she had to utilize a sick day. When she visited the medical services provided through the military, they scheduled her for an appointment for 4 days out. She was sent home with no pelvic exam or ultrasound. The pain was so severe that she went to Planned Parenthood because she could not wait to see her primary care physician. They immediately performed a pelvic exam, an ultrasound, and an STD screening. She was diagnosed with pelvic inflammatory disease, PID. Annually, 100,000 women become infertile as a result of PID, so receiving quick treatment for this condition is critical." And Taylor continued, "Defunding Planned Parenthood means that individuals who experience common reproductive health care issues like this would have lessened chances of receiving quick, necessary, and comprehensive medical care. Had it not been for Planned Parenthood, she could have lost her ability to have children in the future," end quote. Do my Republican colleagues want to deprive military spouses of vital health care services? I also heard from Tiffany, a student at the University of Hawaii who went to a Planned Parenthood clinic after a pregnancy scare. She wrote, quote, "I was afraid because I knew that having a child was beyond my means. I was just starting out my university years at 21, and I have extremely conservative parents who would have surely not approved of my actions. I knew how difficult having a child was for someone in my situation, especially while going to school, and risking sacrificing my future, my key to stepping out of poverty, was not an option. I was unemployed and had Medicaid at the time as well, and Planned Parenthood accommodated my financial situation. Thankfully, I discovered I was not pregnant, and Planned Parenthood took the extra time to sit me through my options without any judgment whatsoever. I was also prescribed birth control, offered an STD test, and was given Plan B in the event I ever missed my birth control. The sense of relief, reassurance, and care I felt walking out of the clinic left me with a very strong impression, especially after so many days of anxiety, end quote. Do my Republican colleagues want to take away resources that help thousands of young women like Tiffany fulfill their full potential? These stories aren't rhetoric, they aren't hyperbole, they aren't spin. They are powerful reminders that each day women turn to Planned Parenthood in a time of need. Some of my colleagues have argued that all these thousands of women who go to Planned Parenthood clinics can go to community health centers if Planned Parenthood clinics have to close because of defunding. This morning, I met with over a dozen leaders from Hawaii's community health centers. So I asked them, could you take in all of Planned Parenthood's patients? And their answer was an unequivocal no. Our communities cannot afford to lose Planned Parenthood clinics. A vote for the CRA is a vote to deprive women like Taylor and Tiffany and millions more throughout our country of these important health care services. Let's stop these attacks on women's health care. I urge my colleagues to vote no.